Waiting on Instacart to get here. Been working away on this 2022 book, but we still got our raggedy, oh my gosh, so raggedy 2021 book here. Look, it's just coming out of its binder. I've got to fix my 2022 so that I don't have the same issues of it being a mess. I had a question inside of chat today about what do you do about your pages that have fallen out? Can you tape them back in? Like this one has absolutely no circles in it at all. And to rethread it, oh my gosh, in the middle of the book, I don't know what you do. If you're fixing to take your exam and you have pages that you need to tape in or leave in, my best advice is to ask your proctor. And I mean, any reasonable human being in person would know this is okay, that this isn't extra. You don't have anything extra crap written on it that shouldn't be on it. It's just part of studying. Some of the pages get ripped out. Now, when you're online with a proctor from another country and they want you to flip through and shake your book out, I'm not sure how that situation would go if you had a piece that was taped in there and it didn't look like it was like in there properly. Like if it was sticking out, would they stop you? I don't know. You need to make sure that it still looks, because when you flip through it, they're flipping through like this, so they're wanting to look at those end pages. So make sure it's at least put in there to where, it doesn't look like it's sticking out or something if you're going to tape it in there or whatever you're going to do. Make sure it's in there really good so that when you flip through it, it doesn't look like it's been added to it. But this is what they're going to have you do. And then you'll hold it by the ring, right, one on side, one on the other one, and you'll shake. Shake it, shake it, shake it. So, and of course you cannot have these sticky note tabs that I have, but I recommend no tabbing at all. Just leave those suckers right there because you're just going to be going from number to number, and you just need to look up here at the numbers super fast, because if you're looking for one number or two numbers because you've gotten the answer down to at least a 50-50 shot, this is where your eye should be, not fiddling with tabs in the way. Always look up here, because then you don't have to go column by column looking up and down for codes. You can look for the range right there to see if you're in the right spot for sure. Let me check on my phone real quick to make sure that Instacart isn't here. He checked out. He's on his way. He was supposed to be here at 5:30. He got delayed somehow. He went and ate dinner. I'm assuming. Sorry about the root beer. It's okay. I kept checking and kept checking and kept checking for him to message me, and he never did. And now, of course, now I see messages. I hope tonight's live is steadier than the other nights, that we have good connection. How's Miss Lovable Auntie doing? Hey Lily, how's it going? It's good to see you guys. MK, all my regulars. Been working on the website, updating some features, working with somebody to help me get everything up. I still don't think he understands all the things that I want in there. I'm able to move like the Etsy items over to the website, and I'll be able to have bigger file sizes. That's going to be a plus. He showed me how to fix it to where it doesn't say to keep reminding me to ship the item, to make sure that it does say it's a PDF, but it did say it was a PDF, but there's another thing to do. But like Etsy has a file size restriction of 25 megabytes, where Wix has one of 40 megabytes. So, and I put one up, which is the E&M guidelines, all in one file instead of two like it's on Etsy, and it's 65 megabytes, and it took the whole thing. So I'm not quite sure if I understand the 40, maybe it's gigabyte versus megabyte, I don't know, but it took the whole file. It'd be nice if it did the whole book, but I'm not done with the 2022 book yet. But as I do, I'll combine files and make it to where it's a bigger thing and get them all transferred over there instead of Etsy, because file size is always an issue. But I'm working on it. I'm trying to add a chat feature so that we can have our Facebook chat room in there. I'm also adding a forum so that if you have common questions, that have already been answered, you can go look at the forum, and we'll have everything listed, like every section. I gave him this list today, let's see, of all the sections in the book. Where's my screenshots? Screenshots. I gave him this list because it's just straight from the exam. So I want one page just for the guidelines so that y'all can go get any guideline help, the names and definitions and things that y'all can write in the front of your book. And then we'll have a series just for integumentary, just for musculoskeletal, where all the photos and the files will be based off these sections for sure, so that we can even have some cases up there for y'all to see. Videos and photos relating to each one of these sections will be separated so that you can find what you need easier. All the anesthesia will have a file with PDFs and photos and videos. Hopefully we can get it all organized and ready for you guys soon. I've got 3 more weeks of sessions working with him to get the site going the way I want it. So it's tiny steps, but getting there. Finding software that will integrate into the system, the website, is challenging. I'm looking for an exam system for like creating my own exams. What I would like is, and I don't even know if they'll let me do it or if there is a system that can do it, is I want one question and you answer the question and then it give you the rationale and then you move on to the next question. And then if you come back and do another go around, it's randomized so it's not the same exact questions in the same order next time. But I don't know if there's a system that can do that. I have no idea. I know the Wix Can program that comes with the website doesn't. So I need to find a third-party vendor that will do that. And it may be, I'm assuming that's why AAPC and CCO and other websites don't have one question at a time rationale. You have to answer the whole quiz to get rationales, that it's something nobody provides. But I don't know. Maybe I got to find me a code writer to write the code to do it for me, but I'm working on it. Am I buffering a lot? Oh, that sucks. Oh, you know what? I didn't put this cell phone on the new Wi-Fi, actually. I wonder if I should Okay. Let's see if this helps. I switched my Wi-Fi connection. Y'all let me know if I'm still buffering as the minutes go by here, as we're waiting on our Instacart guy. It's frozen. Is it still frozen? I swapped me some Wi-Fi connections. Let's see. I'm good now? Hey, Red. Okay. Let's see if that helps. This Google Nest thing, I bought a router, I bought a new modem, and then I bought these Nest things. All kinds of stuff. I was just hoping all of it would help. I don't know where my laptop turned off. I don't know why. Turning it back on. Let's see. Yep. Come on back on. Okay, good. Just waiting on the Lappy to start talking to me. I wanted to see if we could log on to AAPC and just take a whole 50-question practice exam quiz together and see what score we could get. I think that might be fun. I don't know if y'all think it would be fun, but I think it would be fun. So we could do that. I wanted to make sure that if you're doing any of these reverse searches of the anatomy, it's really good to say, and what I didn't do last year and what I'm doing this year in my notes is like this brachial plexus. What's its function? What does it do? That's super handy dandy to write here and here and here and here and here and all this stuff. That would be amazing if you ever have time to do that. That would be great. Y'all like that? I think that would be fun. We just do one live together and just see what score we get. So I'll show you some of the stuff I've been working on. I've been working on the lungs right now, just a couple of pages away from finishing it, but I still got a couple of more things to add. But like, what does the epiglottis do? It protects the trach from inhaled food. These kind of little tidbits will help you out writing in stuff that they don't have labeled, like the primary bronchioles, the bronchioles, what do they do, how many lobes are on either side, and then I still need to add in some things that they do for each other. Super helpful. But here's 2 questions right here from this AAPC CPC exam. The respiratory system, in that order, like what would go next from the pharynx to the larynx, trach, and then what's next? It's the bronchi. That's exactly from one of their questions. And then they have another one about the passage of airflow. It goes from the trach, bronchioles, and then you got to fill in the blank for the next one with the A, B, C, or D. So I wrote them out right there. That's super handy dandy. But also the functions of anything in the front sections of any of these sections will be beneficial if you write that stuff in, for sure. Any definitions of words that you don't know in the middle of your descriptor is super handy. And don't forget, some procedures, even in respiratory, are open or closed procedures. You can still circle your opens when you have and you see those words in green, and then we circle our closed procedures in orange. And then if you find out a modifier can't be used with a certain code, I add that to my notes, or when you can use them, I add it to my notes if it's not noted in your parentheticals. So that's why my notes are super handy dandy to have, but they're going to be even better than last year's for sure. Oops, I just turned on the space heater. I don't think I need that right now. Let me check the phone. Internet still good? Well, the function will basically be a definition, right? It will definitely, sorry, I'm tracking this driver to see if he's close to my house yet or not. It will definitely help out with giving you not only a definition, but it'll give you a function, right? Having the function is half the definition. Like the medulla, it helps control your blood pressure, heart rate, and respirations. That's super handy dandy to know, those kind of things. But definition-wise, I usually save that for the diseases that are known. I just put the body part and the function here, and then where I put definitions will be more of the disease processes that I might need to know for that section. So if I go back to the respiratory one for right here, this is where I do still have some of the definitions, but we'll definitely need a spot for the diseases. I'm not through with this one. Let me show one that I'm through with, like the eye or the ear. When I did the eye, I did the functions of all the parts, right? And then I did the prefixes and suffixes for the areas, and then I did more definitions of things that they might not have. Where's the ear? Ear's got some good ones too. Ear's got the function on all the little areas, what the functions do, and then we've still got areas for the prefixes and suffixes and stuff. Plus bundling what is external, what's internal, and what is part of the middle ear. That's pretty cool. I like that. And just defining a lot of stuff that might be inside these descriptors that you might not understand what it means. Super handy dandy, especially when you have 2 or more parent codes that are the same. Let's see. We have the same words, 2 parents, same ortoectomy, whatever, with, and this one's without, bone flap, and this one's with bone flap. Noting those differences is super helpful because it'll be a difference between those 2 codes if they want to know if you know the difference. And they'll definitely pick those. So just having the difference written down is super handy on those parents. Let me check his tracking again. Whoops, I don't even know how to do that now that I done got out of it. But he ought to be here soon. Travis, what are you doing?
Trying to find a game to play.
What happened to Harry Potter? Oops. I think it's telling me out for delivery. There's the house. I was just seeing where he's at. Because I gotta do. Okay, I hear a car. Let me move this one back out of the way. I gotta show him my driver's license because I got my mom and my kids some cough syrup. He probably thinks we have the plague here. I gotta show him my driver's license, though. I'll be right back. I still need to buy my books and then do all those notes that you have. I know, it's a lot, but it's worth it. It's just one time. You get this all done and pass the exam, and then you get to move on to your career and better your life for you and your family and then your kids and your community. It's really, really worth it. I'll be right back. James, you're still at cheese bacon burger left over from last night? You got any? What's annoying? You're annoying? I know you're annoying. I gotta get my mask out of the thing. Okay, he's still a block away. 1 block away. But he's coming. It's not too bad, Becca, but the first thing you should do right away as soon as you get your CPT book, even if you get last year's ICD10 and last year's hip picks, that's okay. You only have just a few questions. But the first thing you should do is go on and fix your out-of-sequence codes. There are going to be these red ones that show up that say they're out of numerical sequence. Fixing those by putting down the page number where they're at will help out more than anything. Get that done, because there's nothing worse than getting down to your exam and finding out that your codes are not on the page where they're supposed to be, and then you get a range of where they're at, or you get told there's a chart where they're at. Putting down the page number right here that they're where they're at, or if they're on the same page but just rearranged, pointing an arrow to where they're at, that will help save some time. How many minutes do we have now? We have, I keep avoiding the calculator, 100 divided by 4, right? Is that going to help me? That's not going to help me. We got to divide it by 60 minutes and an hour. How many minutes? That's the first thing you should do. I took that exam twice and didn't even know anything about those out-of-sequence codes. After I paid for information, oh my gosh, no one still told me that these were out of sequence, and just putting down the page number would help. That's a huge help. 2 minutes and 40 seconds, do we think? That's 240, right? Yeah. 240 minutes. So if we divide that by 100 questions, we're going to get 2 minutes and 40 seconds. Not quite 3 minutes per question, but more than... Let's see. So 60 plus 60 Oops. Plus 60 plus 40. That's 160 seconds, right? That's fast. Here, he's knocking on my door. I'll be right back, guys. 160 seconds. It's not that one, it's the other one. The other one that doesn't get up and help his mama. It's the one over there playing video games. It's the one with the bar. We have two of them. Thank you.
So what they're going to do? What they're going to do? Tomorrow? The same phone with us? No, you gotta go to school. Why do we have to go tomorrow? So freaking early. Huh? Why do we have to go tomorrow? How much stuff do I need back? How much stuff do I need back?
All right. All back. He was a talker. He was nice. His name was Joshua. He's saying the boy with the cough, all he needed to do was some push-ups. He'd get that cough right out of him. Meanwhile, I got some Delsum. Then I'll make him do some push-ups, right? There ain't a test in this county. I'm sure everybody else. And you know, when Travis got sick around Christmas, right before Christmas, the grocery stores and the pharmacies were full of those little tests. I should have bought more then, but it's okay. It doesn't matter whether the cough is COVID or not. We just got to treat it. And CDC says we can all go to work and go to school with it anyway, I guess. So I don't know what to do. He doesn't feel bad. He doesn't have a fever. He just has a bark. It's kind of like croup. You know, when you had babies, they had a little croup, is what his is. But he doesn't feel bad. He doesn't look bad. He just has a bark. No fever. Not like Travis. Is our signal still doing okay? Travis, no downloading things. Friday. All right. I'm going to move my book over to the side. We're going to get on this computer and we're going to take a quiz from AAPC, y'all. Let's just take a whole quiz in tonight's live and see what kind of score we can get. So let me go to my purchased items real quick. Sorry about the screen being so crappy right now. I'll get it to where y'all can see. And let's take this exam. It's as good as any. Let me lay down my lappy top. Oops, I went to the wrong spot. They charging $2,500 for this mess. Good Lord. All right, here we go. Signal's good? Okay, well, okay. As good as it gets from remote Arizona. I am in the tippy top of Arizona. I am in a place that California is 15 minutes this way. Nevada is 15 minutes that way. So I'm like in the very, very corner tippy top thing. We'll get out this CPT book. Most everything will be in CPT, but I'm sure there'll be some things that aren't. But I just can only have one book on my desk at one time. I don't have a big enough desk for all of them. That's the crazy part. When you go in person to take your exam, you gotta hope that they got enough room for you to spread out with all your books, because you're mostly in your CPT, but still the book is big. It's still a big book, and when you open it, you know, that doubles the space. I mean, at least so nobody can sit really close to you, but you got to think about space for sure when they plan those things. All right. We still got 14 on. Is everybody ready? I lived in 90016 back in the 1980s. Good. My mom is sick. She'll be 70 in February. Oops. What's going on? Why am I here? What's going on here? Let me move this. There we go. Okay. Yeah. I think I tapped out of the live trying to scroll through the chat, and I did something to boot myself out of it. So hopefully we're okay now. I'll stop playing with the screen. All right, so if we have 50 questions at 2 minutes each, oops, don't need that either. What should our time be? I mean, we shouldn't be any more than 2 minutes per question, really. That's still 100 minutes. So that's over an hour. I don't think it would take us an hour to get done with the 50 cases, but 40 minutes, 1 hour and 40 minutes. I don't think it'd take us an hour. I don't know. All right, an hour and 40 minutes is what we should be for the exam. But I don't foresee it taking us that long. But I'm here for the duration, however long it takes us. So I hope y'all can see. and make out the questions. My computer, there we go. And let me get this crane going up just a little bit more for y'all. We do have the timer over in the corner, but we'll ignore that. We're going to go straight to our answers. We can only use our dry eraser if we wanted to cross out anything with the process of elimination, because we're on the computer. So what do we like? We're still going to have to decide whether we're a 0-2 or a 3-2 before we can decide which two to get rid of, right? So what is our 0-2 is going to be simple. Our other one is going to be complicated, right? Because we move up in complications. Let's see what the bottom answer says. It says single layer closure, but I do see embedded debris. So we have a guideline attached to this one. So if we have embedded debris in a simple closure, do we still code it as a simple closure? There's a guideline. Let me see if I can figure out what page it's on real quick. Yeah, Instacart. Our guideline is on page 102 if you're in the 2021 book, and underneath intermediate, the last sentence in our intermediate says that a single layer closure that's heavily contaminated would constitute an intermediate repair. I know that just knowing the order of codes, that the 002 is going to be simple. This one's going to be more complex because we do have embedded debris. And look right here, it says heavily irrigated. We are going to get rid of those. We just need to know the difference between the 32 and the 34. So let's see our sizes. So we know we add together the certain body parts. Extremities are added together. So we have a right arm and we have a right leg. One's 5 and the other one's 5. So I'm already at 10. Our 32 is 7, right? 7.5. So we know that our answer is going to be D because we need to have at least something over the 7.5. So that could be the only answer. We're at 3 minutes with that question, but I was trying to teach during it. So we've got toes, right? T's. Are we doing a toe? So process of elimination, we can definitely get rid of that 65, right? We'll just keep the 50, 30, and 40. And our differences in those are, what, guys? Yeah, I can center it some more. Is that more helpful? There we go. So we're up here on number 2. I got rid of a 65 because I felt like the process of elimination gets rid of that one for sure. So we'll go to the 30, 40, and 50. 117. 117. So 117. Our 30 is avulsion, which means that they're going to remove underneath the nail plate. So I don't know if you can see my fingers because it all looks black to me in my camera. But underneath your nail bed, you have a nail plate underneath here. When you do an avulsion, you remove the nail plate underneath there. So that's the 20, right? No. Is that the 30? The 30. That's the 30 is removing the plate. 40 is evacuation, and 50 is an ingrown nail. And what are we doing? We're doing the ingrown toenail. So we can definitely keep that 50. Y'all agree? Is it too close? It's too close? Okay. Just needed it centered. So I think it's going to be 50. I just wish the camera would stay still. Okay. Number 3. We're at 5 minutes right now. So we need to know the difference between the 4-4, no, or the 4-3. I don't know. I like the, oh my goodness, they're just all over, aren't they? Somebody's already come up with the answer A. Number 3, if we're doing basal cell of the left chin, the 11443, 11443 is under excision of lesion. It's not malignant. We know we're doing a malignancy, so you know you can eliminate these two for process of elimination. Then we just need to know the difference between the 116 and the 144. I am going to take your suggestion that it is A, but I at least got you to know the difference between the 1-1 and the 1-4. Let's move on to this one. Oh, I love these. I love Moz or Mo's, however you say those. These are my favorite. I love these. So we need to know if we're an 11 or a 13 first thing. So where are we at? We're on the neck. So the neck is going to be under the 11, right? So we can get rid of the two 13s because the 13s are the extremities. So all we need to know is if we need to add the 15 or not. So all we have to do is look for blocks that are bigger than the number 5. So we have the first stage right there, and the first block is a 4. So that is not over 5. Our second stage is a 2. We do not add these things, Mo's, Ma's, we do not add in this section. If both numbers are under the number 5, we do not use the 15, so we know our answer is going to be D, right? Let me know if any of this is not clear, because I don't really care about time, but I can stop and help you learn about this more. But yes. Number 4 is most definitely D, because neither one of those stages were bigger than the number 5. If they had been bigger than the number 5, then we would have added them, added that particular code. But we do not add any stage together. There is no adding in Moss microsurgery. Absolutely no adding here. So you might want to write you some notes on both of these. The stages are considered, whether they are over 5 or not, on their own. That number 4 and that number 2 are both under the number 5 and not over it, then we do not use the 15. All right, muscular skeleton. What are we doing here? Number 5. We are going to do, I really like the 77 and the 76 because they're super close. We might even consider keeping the 75, but let's definitely get rid of B. So 230. I got to get there. I'm not as fast as you guys are in the books. 230. 75. Oops, I'm still in the 2 2s. Where's 2-3? Lord help. 230 75. Okay. And then our 77. Okay. And 76. All right. So both 75 and 76 are excisions. They're both tumors. One is soft tissue of the shoulder. The other one is soft tissue of the shoulder. One of them subcutaneous. One of them is superficial. So that's what we needed was subcu, muscle, or bone. What are we digging in? How far did we go? Subcu. Can we see all of the question? Oop, there's a muscle listed right there. Word. So I think we're in muscle. I think we're in A. What do you guys think? Muscular? 5 is A? Yeah, we got 5 as A. Okay. Number 6. We are at a hip PICS for fracture. So what do we love about this and what do we want to get rid of? So number 6 would definitely get rid of D, right? And does anybody have the differences for 10, 11, and 12 in hip PICS? Oh, because I don't have that book out, but I can get it out. Y'all know the differences? One-word differences? A, B, C, D, E, F, G, H. There's Q. Okay, Q4. I'm at Q2. Q4, O12 is, okay, and 10. Okay, so we got short arm cast, adult, pediatric, and fiberglass. What are we doing? Fiberglass was the last one, so that one is A, right? 6 is A. Fiberglass, because the other ones are plaster, or is it 10? How old is our patient? You're right. Our patient is 12. And so they're still considered 11 years or older. And that one's fiberglass too. So the other one, the 12, is for 10 years and older. Good catch, good catch. I might have picked C and moved on. So good catch. All right. Number 7. We're at 12 minutes and we're on to number 7. So we're doing good. We've caught up some time. What are we doing here? 7 is, we are going to do, I really like the 1s. I'm just going to get rid of the 2 and the OO. I'm going to keep these. So I either need to look up the differences between the 79 and the 85, or I need to see if there's any parentheticals about what to use. But since they are being used, I'm going to assume that they can be used since they are being used. And what else am I going to do? We've got a throwaway here in A that matches the same. Over here is B. So if I wanted to guess, I could guess B because that's got the same right there. I like B. What do you guys think? 29. Oh, that's hip PICS. Let me get that book out of the way. 29. 298. 298. 298. 79. 79 is abrasion, autoplasty. Yep. And what are we doing? A meniscus tear with the chondroplasty. We got chondral right there. So yeah, it's B. It's gotta be. Gotta be B. Move it over. My darn crane. Is that where you want me to move it? Is that better? Let me know. Move these up. Okay. Number 8. We're just looking at the numbers. Oops. And I like 22, yeah, and 24 go together, and then 59 and 58 go together. So we need to know the differences. 27, 27.2.2 is a repair. And what is 277.5.8? 5.8 is going to be under a fracture or dislocation. So what are we doing? We do have a fracture, right? We do have a fracture. But non-union without graft. This one is autograph. What are we doing? Are we doing an autograph? Three screws placed in there. Number 8 is A. I think so too because of the diagnosis code. We've got it in one of our throwaways down here too. It's listed as double. Yeah. You see how that diagnosis code is the same as this one, and I would throw away the 258, 58 and the 59. Yeah, I think that's the answer. Number 9, where are we at? We are going to be doing the 26 and the 28. I would get rid of B and C, or D, I mean. We would keep these two. What's the differences between our modifiers? The 76 and the 78. 76 is a repeat procedure by the same physician, and 78 is unplanned. What's going on with our patient? Malfunction is definitely unplanned, right? So we know C is going to be our answer for that one. Can y'all see the screen okay? Is that all right? Number 10. Y'all are saying C. Y'all are ahead of me. 55 and 57 is what I would like. So 3655. 3655. Ooh, we got in the heart. I love the heart. So what you have to do here is to remember to see where you are. Are you atrial? Are you ventricular? Or are you both? So 3-6. Anything in the hot? 3655. Or are we doing shunts? I haven't even made it there yet. 3655. 555. Non-tunneled versus tunneled. So we do have a tunnel. We have a tunnel. So we are going to keep our 7 because it is tunneled, right? Tunneled. For a kid who is 2 years. 57, 2 years. Younger than 5 years of age. That's why the 57 is a good one, because we've got a 2-year-old. And we've got the tunneled. All right, number 11. Patient's rights to medical records. Do they need an attorney? No. Is it some sort of violation of federal law? No. Revision of the record depends solely on the facilities. No. It's protected by rights, so that's B. Absolutely B. Which statement is true? I hate it when they say which one is false, because that drives me nuts. I can't do those. This one, which one is true? Sequel is not acute, so that's wrong. D is correct, right? D is correct. And because we would not only do the acute condition, we would do both. And then this one, What's wrong with this one? Is valid even if it's not been coded fully, number of characters. No, that's not true. So it's got to be D. Yep, got to be D. Thank you, thank you, thank you. All right, number 13. Arrhythmia. Back to our hip pixies. So I like the 260s, right? So a difference between most definitely A and B. So we got C. I know where the C is in the alphabet without singing it. So 1764. 1764 is an event recorder, implantable, and 67 is generator, implantable. What are we doing? Event recorder, so it's 4. So we definitely have the B, right? All right. 14. Put the hip pick books away. We've got a difference between the 20 and the 49, and then we see if we need to add on a code. So 4322, 43. Let me know if y'all have questions. 4322, 4322. 43220. Out of sequence, as usual. Is under what heading? We got a heading of a scope, and then the 343 is under EGD. And we definitely have an EGD going on. So we'll get rid of these two down here at the bottom. We just need to know, is she getting the extra crap on the end? And if you look under the parent code for EGD, the 35 that is with the parent code, 3235. Is it in there that we cannot use that one with that one? Yep. We do not. It's in our do nots, our parentheticals. We can't use that one with that one, so we can only use that code. Next one, 15, and we're at 23 minutes. We have, ooh, I like the 80s, right? And we just need to know if we need radiology for one of these, right? So we go to 503.85. 503. 85 is a removal, and then 88 is a WASA. No, I'm under the wrong ones. 306. I was under 503 instead of 506. 503, 85. Mm-hmm. 503.85. Yeah, that's still a removal, right? And then our 506.88 is 506.88 is a change. Are we doing a removal or are we doing a change? We're doing an exchange right there on the bottom. So we'll definitely use that change. Code. All right, 16. Love the 240s. So I would get rid of, I don't know. Oh, the 250s are the same thing. So 572, 572, 572, 572, 40 is under, it's a shame we can't talk during the exam because that's so helpful to talk out loud. So 57240 is anterior, and then 57250 is posterior. What's we be doing up here? Are we posterior or anterior? Where are we at? Do y'all see it? Y'all can't see it either? Cool. Here we go. Anterior. Y'all are seeing anterior? Here it is, an anterior. Yep. Yep. Sometimes it's up here at the beginning, and sometimes it's in the middle. You just have to try to guess where you're going to start doing your word search for sure. But yep, we're doing anterior, so we'll keep the 40s. Now we just need to know if we need the 2 or the 3. So 572, 82, 82 or 83. So are we doing intraperitoneal or extra? Extra or intra? They love picking on those questions. Oh my gosh. If it's intra or extra, one little letter difference, I or an E. They said anterior again. Where's intra and extra? Do y'all see it? Read it backwards. Can't see the question. Oh, is that helpful? Okay, come on. Intra or extra is all I'm looking for. I guess I wonder if it's the patient's position that's going to make us decide if we're intra or extra. Do y'all see it? Not yet? Spine. Anterior passes through the ligament bilaterally. Intra or extra. This is where we're supposed to be at. Sorry about the lighting. Intra or extra, we're vaginal. Peritoneal. Intra, it's going to be the approach. So how did we approach this patient? It's going to be up here at the top. Midline level, vaginal cuff, vaginal flat chest. It's got to be up here in our intra. It's the sac word. Yep. Our AKAs are always in those parentheses that she's pointing out, and that's how she found it. Instead of looking for the extra and the intra, she looked at the AKA terms and found the sacro. And this one, it would have been the urosacral. Yep, your AKA terms. So if you have these and you have them highlighted like I do, you might want to make note of the sac word and then the my over here, or the levitator. Anything in those parentheses they might use. Great spotting. Absolutely. Love it. 82. Very good. I know this one, our ABN is GA, right? Everybody should know that one off the top of their head. All right, we've got in left. So we've got 14, 16 and 17. I really like 16 and 17 because they're super close. 6, 9, 7. We are 6, 9, 7, 14. That's an implantation. Our 16 is a replacement, and our 17, yeah. We are doing, he had a hearing aid. So we are doing an implantation. We're not replacing it. We're not doing anything else. He's brand new. He's never had one before since all he had was a hearing aid. So we're doing the implantation. This one, which ones do I like here? I like the 10 and 20. They're closer than any, I don't know, 52 I guess is closer to 60, but I don't know why. I like all the O's. I like all the O's. I'd get rid of the A. 60. 60. We're going backwards in the book. 60. Neuro. No. Yes. No. Urinary. Let's see. 60210 is partial. 20 is total. And 60 is a thyroidectomy. What is this guy getting? He's getting a lobectomy, so he's definitely not getting the olectomy. So is he getting a total or a partial? I think he's getting a total, isn't he? Total? I think he's doing total. Can you scoot the camera over to the left? Do you mean, I don't know if it's my left or your left. Like, do you want more white space on this side where the answers are? Or do you want me to keep it super close? You're doing good, Shawnee. Yep, very good. All right, so this one I think is a total. No white. Okay. This one right here. Are we in the OTs? Back in the back? Or are we at the 60? I love the fact that these are the same. These are the same. What's number 20? We are going to be in the back, huh? We're doing branch blocks of crap. O2. Where are we at? We got to go see our differences. 021. I don't do very many of these in our practice quizzes that we do, so this is pretty cool that we do have it. So the 0216T is an injection therapeutic agent in the paravertebral fossa. It's also can be called ZYG joint. Do we see anything that starts with a Z? Or called paravertebral fossa. There's a faucet. I see faucet. The 64493 is, let's see what our difference is before I linger too long here. But I'm thinking it's one of those. 644. Six 4493. Yeah, that That is an injection of a therapeutic agent, also of the paravertebral fossa, zygote joint. Of course, it's the same two descriptors. This one is involving imaging guidance, a fluoroscope. Our T1, 6T, is ultrasound. So are we doing fluoroscope or ultrasound? We're doing ultrasound. So that's the difference. Wow, both those descriptors are the same, except for this one is fluoroscope, and they're so far away from each other. And this one is ultrasound. It's the only difference. That's crazy. Now, would we be doing the T17, the 17, 18, and 42? This makes me nervous with all this. And it does have a parenthetical underneath this one, the 16, that says if it's bilateral, use the modifier 50. So we're rocking there. We would not use a ×2. So we're good on that. A makes me nervous with all that crap. It does say to use the 16 and 17 together underneath the 17. It says we're supposed to, and it says the 18 you can only report once per day, and they have it as a ×2 up here. So definitely going to be our D, and we can move on to our next one. So if you look up the 18, it'll say only use it once per day. So I don't like A. It's too much stuff. E and M, love it. Let's get back to some normalcy, but man, I love that question. That was good. We have an established patient. What is our 21? Is that inpatient? Are we back to inpatient right there? I think. What is our 21? Pretty sure that's inpatient. (99221) is inpatient hospital. 23 is inpatient hospital high, and then 85 is who knows what. I hate that they're all separated and all out of sequence. 85 is emergency room. Remember, do not look at these things as ER, ER, ER. Just ignore if they do have anything set up like that. So, physician sends the patients to the hospital for admission. So we're definitely going to stay in our admissions. He is saying his complexity is high. Do we agree with that assumption? It is our job to make sure he does not overcode. Would we do a 23 because he says he did a high complexity of decision making on a 15-year-old? When would a 15-year-old really have? I know he's a new onset of diabetic insulin and all that stuff. He's going to have to learn how to do that, but he does not have, like muscular sclerosis or something else with him. I wouldn't give him a high, even though they say high right here. I would give him a low. Inpatient. What do y'all think? Do you agree? Yep, we've got the admit. What do y'all think about the 21 versus the 23? Ooh, my kids are quiet. Let's see what my other demon child is doing. Tell Travis to come here. Okay, well, when he walks out, tell him to come here. Go knock on the door. Well, look at the TV. Knock on that door and tell him to come here. Ooh. Child's on YouTube. He's going to be in here taking the exam with us. So we have a new, and established, for the next one. He didn't meet the 2 out of 3. Great, thank you. Blood sugar is really high, yep. He's just got one chronic disease, exasperated, of course, but I don't know. This one right here, we have return, so we know we're going to be established. So it's either a 14 or a 15. So this one, blood pressure sky high, she's in distress, shallow breathing, oh, she's circling the drain. I'm giving her a 15. I hope y'all agree. But I would. That's scary.
Yes, I was pooping.
Yeah, you're shutting the door and you're staying in here. Yeah, look at that TV. Look at the TV. What does it say on that TV?
I was scrolling through. So.
Yeah, and you're not paying attention. Shut my door and you come here and you sit down with me. You know you're not allowed to be on YouTube when I'm not in the same room with you. You have been just a pistol today of doing all kinds of stuff you know you're not supposed to do. You're just not going to behave today. So you get to be supervised, okay? You got to stay here with me. All right, our next one. Can you ever do this 217? What the heck is that? What the heck is 217? 217? Where are you? Observation, discharge. Oh, okay, I guess we could. I was thinking about that prolonged service one. So we're on 23. So that's a discharge. What is 99235? What's that one? 235 is observation or inpatient care. And just so you know that this 235, if you read your descriptor, it says you can do this one for evaluation and management of patients, including admission and discharge in the same date, which requires all 3 components. So I bet that's what they're going to ask us about in this one. So let's see what's going on with our patient. So we have an ER and we have dehydration. So they did stay and get IV, of course. So they were in observation and they were discharged home late that evening. So I would definitely pick C, not just a discharge, but an admission and an observation and the discharge, which is all included in the 2-3. I hope y'all agree. Can y'all see okay? I hope. All right. Ooh, the 9-1s. Love the 9-1s, right? Where is my 91? I'm going to my chart. I think we're going to be doing critical care. All right. Page 32 if you're in the 2021 book. So let's look for a time. So right here I've got 65 minutes. Was there any other time listed? Nope. What's 65 minutes? 65 minutes is just the times 1 by itself. So I'm doing that and I'm going on to my next one. Anesthesia. Gotta love anesthesia. Are we doing 1382 or 1400? 1382. 1382 is arthroscopic and 1400 is open arthroscopic. What are we doing? What are we doing? What are we doing? It doesn't say whether we're open or not, but it does say monitored, right? So I'm going with the 82, and we have a MAC, so we're definitely going with the B because we have the MAC, and it's the only one with the QS with the open procedure. 0032, 00320, 00320 is anesthesia for esophagus, and 26 anesthesia for larynx, trach, blah blah blah. We have a 9-month-old. Do they have the descriptor in the thing? Yes, they do for the 26, and the 20 does too have an age in there. So we would not use the 99100. So my answer is C. C all day long. Very good, guys. Very good. Okay. 27. Same modifier. We've got the 1, 2, 3. We can't do nothing but go to those codes. In your real exam, they're more in order than going all over the book like we've been doing. You'll definitely take care of all the 7,000 codes together instead of flipping around like we have been, but that's okay. 788, 88, 01, 02, 03, 04. So we've got a difference in 2 or more whole body, and a spec. Are we doing a spec? No. I don't see the abbreviations for spec, so we can get rid of the 3. It's probably a difference between the 2 whole bodies, so it's single day or requiring more days. So how many days did this patient stay in the hospital? 3 sets of images. Don't I see 3 days? Wasn't there 3 days? 3 days. I did see it. 3 days. So we will keep our whole body and do our requiring 2 or more days. So we will do our 4. For sure. Thank you for the follow on TikTok if you're in our live. Let's go do this one. 7, 6. I like the 7s. We'll get rid of the D for now, for sure. And let's go to the first one, 76700. 76700 is ultrasound. We got the 05 is limited, and the 06 is aorta. The 00 is abdomen, and then the 05 is limited to 1 organ. What are we doing? Order of the liver. So we're doing 1 organ, so it's the 05. All right, we've got number 29. I like the 235s, don't you? So then all we need to know is, do we do chemotherapy first or cancer first? And another way is you would never, ever diagnose them with the cancer and the chemo in this order. It just won't happen, ever. So I know my answer is going to be B, because you don't do that they're here for radiation or chemotherapy at the end of a visit if you're seeing them for cancer. That code will just not go there. You would only code them for that. Anyway, so I know the answer is going to be B. It's just the way it is. We've got 2 that match, and if you know that they're here for radiation treatment, which they are, and even if you look here at the last thing, it says deliver a dose, well, they're here for chemotherapy. The Z51 always goes first. And just because I have 2 with the same, I'm going to go with that and pick that 35 and hope that it's not the 7-3, but trying to save some time. We're at 49 minutes and we're on question 30. So let's see. We've got, the 202s. Then we just need to know the difference between the 77002. 77002. 77002 is fluoroscope. And then the 76942. 76942 is ultrasonic. And so, right up here, we're doing fluoroscope. So we know B is our answer. Easy peasy. Let's see, number 31. I like the 54 and the 55 because they're super close together compared to the other two. So 89254. 89. James. Way back here. 89255. Way back here in the backy.
Go turn off the PS5 because Sean's going to get mad at me if it stays on.
Well, he's going to be mad at you for being on YouTube, too. When are you going to not be on YouTube?
Don't do it anymore.
Why would you do it in the first place? You know I don't allow YouTube use. Oocyte identification versus preparation for transfer. What are we doing? She's getting ready for infertilization. So we are definitely going to do our 54 for our follicle fluid identification, matchy, and then we've got identify right there too. So we've got 3 words that match. Love it on 54. Oh, our arch nemesis, the 803s. These are the lovely ones where you got to do that word search, right? Maybe, I think. 803, where are those? Could be wrong. No, these are drug identifications. Okay. Oh, these are just out of sequence all over the place. So 803 is where in the world? 80305 is on page 590. 6 pages away from where it should be. So this one's doing just a visual drug or an instrument or a chemistry analyzer. Which one are we doing? They got visually read, right? Visually read, so we're going to keep it with the 05s. Would you ever do the 05 twice? No, you wouldn't. So we'll keep it at B. B is going to be our answer because we're visually reading the dipstick. Absolutely. $32 was B. Everybody was agreeing with me? Okay. $33. 33. What do we like for the process of elimination here? 25 and 29. Yeah, I don't like the 44 and the 05. So 88325. 88325 is, oh yeah, I did this one the other night with you guys. This is the records one, and then the 29 is the during surgery. So do we see records in here? We do see patient records. So we'll pick patient records. Super easy. Yay. All right. This one, which one do I like? I like the 67 and the 70, right? So let's go look up 965.
Please, Father, Cartoons, I promise I'm not going on YouTube again.
Let me catch you again. You'll be in your room, Travis. No YouTube. Not without parental watching over you. You can watch it with me, but not by yourself. That's why they don't have TVs and stuff in their rooms. All right. So, first 30 minutes, how many did we do? 67 is per day. Application of lights to destroy per day. And then the other one, 70, is an add-on code. So that one could never be, ever be a code that you would use just all by itself. Because it has the plus symbol in front of it. So it's got to be C. And we move on. Back to E&M. Let's go on and do the 908 one because we're back here in the back instead of moving to the E&M. This will save us some time flipping around in the book. So 36 is, let's see, I like 45 and 47. I do. 908. 908. 47 is in front of me. Family psychotherapy. 45 is psychoanalysis. And what are we doing? We're doing inpatient. None of these are inpatient. So it's not my process of elimination ones. It's not going to be these. I got to go back and look at the 3-2 or the 5-3. 5-3 is group. That wouldn't be it either. So it has to be B. Has to be B because it's inpatient. Okay. Finally, something easy. Where is CKD, guys? Where is CKD? Are we in musculoskeletal, digestive, geno, or circulatory? Yeah, geno. Okay. Nephritis. Where's nephritis? Gallbladder, nerves. And they're trying to direct you to nerves, like inflammation of the nerves. But where is neph? Where is neph? Kidneys, yes. Very good. We all remember what the A, this one means. I wrote it down on a little sticky note for you guys recently. I don't know why I wrote it down on a sticky note, but I do. I have the sticky note here on my desk still. That this one, if you're looking for process of elimination, abdomen, this one is really difficult because it's fluid in the abdomen. And even with the A in front of it, usually means without. So it's just a crazy word that means fluid in the abdomen. Might want to keep that in mind. Put it in your digestive system area as a definition. It's a great place for it. Where is paralysis of a facial nerve? Most people know that's your Bell's palsy where you droop, right? Oh, Lord. Anybody know the arteries of the heart? Where do they go? Pulmonary, aortic, mitral valve, and then where? Where are we going? Atrium, carotid, superior, or tricuspid? What do you think? Do I have a B for that one? Tricuspid, a B? Or superior? We've got superior, and we've got even a D for atrium. How I remember this one is I try to spell out something. So I'm trying to spell pass because I'm going to pass my exam, right? P-A, pass, my. And the last thing I can fill it in with is test. So tricuspid is where it goes next. So if you want to write this down in your cardiology, I like pass my test is how I remember these back from the early 90s when I took A&P. Pass my test. That's all I want to do is pass my test and get out of here. Okay, where is overload of sodium? Think about your periodic table when you were in elementary school. What was the symbol for sodium? Anybody remember your symbol for sodium? Thank you for the likes. Yep, Na. Very good. Yay. Na, which is right here in the middle. I got this wrong 3 times. I just flaked on that question during my exam. I did. And then it was on a practice exam and I got it wrong too. Yeah, some things I just learn, I lose all meaning of. What is the term paracentesis found in 49082? What's going on there? What are we doing? So when you have that fluid in your abdomen up here, this ACE, where did it go? That, whatever, how you pronounce that. What's the procedure? Look at that. To drain the abdominal fluid that accumulated. That ties into that other question. It's kind of funny how they do that. Diagnosis is, all right. Oh, let me switch books. Get out our diagnosis book. Where to put it? Where to put it? Lord help. All right. Diagnosis book. What's our differences here? We got 42 and 42. So it's either, oh God, 31, 31. Good gracious. What are we doing? Oh, yeah, Burns. Gotta love Burns. So I like the 31s. I would get rid of the 32. Keep the 31s. We need to either be in the 22, 24 range, maybe. So T31. After all these pregnancies, T31, T31, 22, is that my first one? Y'all are faster than me. I can see the chat scrolling. 31, 22 is burning 20%, 29%. What are they asking though? The question says, reported burns classified according to the extent of the body surface involved. Are we doing the whole body or just a third or a fourth? Total body is 45. We're not there yet with the 22. So what's the 24? We don't have in our book. I don't have 24 in my ICD. Does anybody else got it in theirs? I don't have it in mine. The 24. Okay, let's see what 42 is. I won't linger, but 42 is the 40 to 49. So, is it D? It's D. But does anybody have that number in their book? The 24? Like, I don't have 24 in here. It might be in the 2022 book. I'm in the 2021. I just grabbed it. But interesting. Okay. We got T codes or K codes. Are we doing external causes or are we doing regular diagnoses? That's going to be what our differences are on that one. So I'm going to see a little bit. She has GERD. Currently been on medication. She's positive for Barrett's. She got a hamburger lodged a few days ago. So she's just following up on all that crap. So she's not choking now. She's just following up on it. So we know we're going to be in the Ks. So K22 is what? Are we doing 22.2 or 2270? C, D, E, F, H, I, J, and then K. K22. K22. 2 is obstruction, or 70 is the barrettes. She doesn't have an obstruction anymore. She's only got the diagnosis of the barrettes right now, because that was just a temporary thing. So we'll pick D. Ooh, more CPTs. I thought I was done with this. All right. Where am I at? 4 questions away. I gotta go get out a different book. Where is it at? Where's the CPT? Where did I toss it? Here we go. All right. 46. I like my 52s, my 00s. Those are all close. I get rid of B. So 5200, 52. Travis, what are you doing? Five, 2, 0, 0, 5, 7, and 0, 0. 0, 0 is a scope. So's the other one. This one's with a urethral, and the 07 is a brush biopsy. What are we doing? Can y'all even see? I'm like way up here, and yeah. Catheter removed, and that's it. So I am going to keep her with just the catheter. Because that's all they did was a catheter. I don't see that they did any brushing or anything else. They were just working. Yep. I like the 05. Everybody agree? Is that one okay? Remove the catheter? Okay, good. Y'all are a step ahead. All right. This one, I like the 250s. Then all we got to do is decide a diagnosis between the 20 and the 90. It's in both of our throwaways, so I can't decide that way. It'd be nice if there was only one. So our K40 20 is what? K40. (40/20) is bilateral, not specified as recurrent, and yep. And then our 90 is unilateral, non-specified as recurrent too. So we got bilateral and unilateral. Are we bilateral or unilateral? Just left inguinal hernia, so she's only the left. So we're definitely going to pick our unilateral instead of bilateral. So pick our A. And this one, I like our 221s, right? Yep, so all we need to know is, does this one get that one along with it with the diagnosis of 03? 03 is up here. We have an 02 up here, though. I bet it's going to be D without the other one. Does it have a parenthetical? It says you can't use it. The other one, I wonder. 428. Yes, it does. It's D. I figured it'd have a parenthetical. 428. 428. Yeah. 42821. No parenthetical. It's just under 12 years old tonsillectomy, chronic tonsillitis. And they did an adenoidectomy at the same time, but this surgery (21) does the adenoids with it, so we don't need to code them separately. This does both of them. So we're good with D. 49 is, I like the 25 and the 24. So 298, 298, 298. More meniscus tears, right? These are a pain in the butt. 29824. Somewhere around in there. 29824 and 25. Our differences are a lysis or distal. So what are we doing? What are we doing? 20. Are we doing the distal? We're not doing the lysis. Yep, A. Y'all saw the lysis in here? Y'all see the lysis? See, I see no lysis. We're doing it's called the Mumford's procedure, right? Did they even use that in here? No, they didn't use it in here. But see that cocora ligament? And there's no adhesions. We're not seeing that they did anything about adhesions. The other one, the 2.5, would say stuff about adhesions in here. All they did was a bursectomy, removing that, a distal claving, distal anterior cervix. And see, it keeps saying anterior, anterior, anterior. I think the 2.4 is right because yeah. 50, we'll see if I'm right or wrong in just a minute. 50, our last one, I'm assuming, is going to be our 28, right? We just got to figure out if we're a symptom or if we're cancer. So we've got lung mass. The pathology indicates that this is cancer. So if we were just picking from just these CPT codes, I would pick the cancer code that goes along with it. Now, we do have an extra procedure here, but for time purposes, AAPC likes to make sure that you don't overcode, so I'm going to assume that that doesn't go there, and we're going to do the B. We are at 1 minute and 13 seconds for 50 questions with my process of elimination, and my wrist is hurting from searching through those books so fast. Geez, Pete, I don't want to work that hard no more. But let's see what we got on our score. Internet still worked okay throughout all that, I hope. We've got 47 out of 50. Let's see what we got wrong. We got our fiberglass wrong out of our hip picks. I wonder what we did wrong there. We should have picked C. I bet, the one I was trying to go for, and y'all talked me into the 12. That is going to not happen again. Y'all can't talk me into... Y'all had me changing my answers on that one, I think. Remember? Oh. The 12-year-old eliminates the... Yeah. And the fiberglass. I remember that one. Y'all talked me into that. All right, let's see. What's our other ones? This one. Did we need to do a different one? We didn't pick. All I did was look at the first code, and I know I didn't look up the differences between the radiology and the 644. What did I do here? I don't remember. The ultrasound, maybe? Was that all I looked for? And didn't pay attention to the last digit? Wonder why. Why would I've did this? 64495 and then the 769. I don't even remember looking those two things up. Why would I have picked this one twice? Did I? What was the answer? I'm sitting here clicking on things. So the ultrasound is not reported separately, eliminating the A answer. Did I change the answer while I was sitting here? Yeah, I did, didn't I? What did we have picked? 20. Should have been D. I thought I did pick D. Did I just click on the wrong thing when we were... Remember, I didn't even look up these two codes. We went to the T's. And I said that the 16 goes with the 17, and we could not pick out the 18 because it's only reported once. I just clicked on the wrong answer at some point. So that's just a typo on that one. I remember it now because we didn't even look up these codes. I went straight to the T's. All right, I did a typo on that one. This one, I didn't even answer. I forgot to go back. Remember, I was doing the process of saving me a turn in the book, and I skipped from this one down to this one because I didn't want to go all the way to the E and M's and then go back to the back of the book. So I skipped a question. Oh, I'm such an idiot. Okay. Let's see. What did we do here? We've got 83 and 84. What's our differences between those? So that's why I cannot skip questions at all. I have to go one by one or I am screwed. So we're definitely going to get rid of the 84s. The differences between these are the 55 and the 52. So 991. 991, 99152 and 53. 53. Give me an answer of B on this one. Yep, the other one was that one, and then the other one was a typo. I apparently bubbled the wrong one, and then this one, y'all talked me into the 12 instead of the 10. I can do that, right? And then we'll grade again. And now we've got the 50 out of 50. Let's see. So if we did that even with all my stopping and trying to teach and counseling Travis during the exam, we did 73 minutes, right? 550 questions. We were 1 minute and 40 seconds each. We still had a minute per question we could have spared and saved out for those, because you get 2 minutes and 40 seconds. So we did it in half the time needed, and I had that. Thank you for the roses. We did it in half the time, even though I was slow to start, and I skipped a question, typoed a question, and those things might happen to you during your exam too, so you got to stay focused. I had a lot of distractions here too with the kids and stuff, and don't second guess yourself. You see where I paused and second guess myself on the fiberglass versus the age. I didn't slow down enough to focus more on that question and just let it go, is what I did on the hip picks. So still a 47 would have passed. We would have been just fine. But that was a lot of work, and so is the exam. With the process of elimination and just finding those codes, flipping through the book fast enough is one thing, and then you've got to know your differences between the codes right away, and that's where I think this boxing and highlighting is not the route to go that we've been taught to do year after year. What I think is going to be more helpful, and that I'm putting my faith in and doing it this year, is putting down the differences between the codes, next to the codes, right underneath the numbers, so that I know right away what the differences are. I've got a complete, a moderate or a radical, something that is just super easy. I've got an excise, a resection, a polyp, a glomerulus. Just one words that mean the difference in those codes, because you're just going from number to number. You ain't indexing nothing. You ain't looking up codes. You're not doing anything other than going from code to code. One with a shunt, one without a shunt. Something that is your one difference. One's lateral, one's medial. I'll know that that's the word that I got to go and search my question for to find the right answer. I think that will be more helpful than anything else. Now I feel I can pass. I'm so good, MK. That's great. I'm hopeful that this did help. I will post this repeat live on YouTube. If it records, please and thank you, TikToky. And we can do another one of these as soon as my wrist heals from this. I can't do a live on Friday because tomorrow I'm leaving for Phoenix. I got to take Travis down to Children's Hospital. We're staying overnight, and then we'll see them on Friday and then drive back. It's just so far, 5 hours one way, that I didn't want to do the trip in one day. I've done it before in a snowstorm, if you can believe it or not. Before, I did his barium swallow. He has a texture issue in swallowing, especially when he was a baby. And we did it in the snow one time, but I don't want to do that again. I don't have to do that now. Now I can get a hotel. We can make a day out of it. And we like to stay at the Drury Inn, D-R-U-Y, whatever. They're super nice because they feed you dinner for free, and then they give you a breakfast buffet. So I'm like, I get to save 2 meals, and the hotel's pretty clean, and it has an indoor pool, which the kid can just have at it, wear himself out. So, little mini vacation, but also to see some specialists down there. And we'll get that done. So I won't be able to do a live until Saturday again for you guys. So I will be back then for sure. I'll have, of course, I'll be in our chat room, sharing pictures and monitoring and making sure y'all are still studying for sure. If you need to join or would like to join my chat study group, come find me at Jen Brewer on Messenger and I'll add you into our chat group. Just message me there. Don't find me anywhere else. Find me there and I will join you into our group. And they work pretty hard in there all day long, share all kinds of stuff, and help each other out. And we will... I love seeing this codify thing. That was pretty cool that somebody shared about what the codify looks like and what you're supposed to do in that. I thought that was really interesting. But super helpful chat group. Of course, I'm working on my website. If you want tutoring with me, it's available on my website at Medical Coding by Jen. And you can schedule tutoring one-on-one with me where we can go through exams just like this. You answer the questions. I'll tell you tips and tricks on how to get through this process faster and answer the questions appropriately. You'll have more modifiers on the exam. This exam didn't have very many modifiers. Maybe one question had a modifier, but that was it. You'll have more. So be sure you know your differences of your stop procedure, de-seed procedure, reduced services, those kind of things. They'll definitely go over those and adding the 25 modifier. But this was fun. I'll do it again. I'm just not sure I'll be ready by Saturday to do it, but we'll definitely do this again. I'll have more practice exam questions too. And I know a bunch of people are taking their exam this week, so hopefully we'll have some updated information that was on their exam. I did give out 3 new questions that were on someone's exam on Monday in our chat group. Those were shared inside there. They were the exact questions from her exam that she had on Monday. I know that we will not have questions that are A, B, C, D, E answers. They're all just A, B, C, or D. So that's one question solved. Other than that, I don't know. We've got more posts coming of more updated information as far as vocabulary words or what type of questions were on their exam. Coming soon. It's just people having a hard time scheduling and getting it done during this bad weather time too. So I hope this has been helpful. Yeah, they want you to pay for, I never considered not paying for the membership. I guess that is one of those things that you have to have is the membership and to take the exam. Unfortunately, it's another $180 they want from you, and you'll have to pay it yearly. And you will be have to continue your education to keep your certification. So you'll need 36 credits every 2 years to keep your certification. So it doesn't stop here, but this is the major thing. You got to do this. And then you can get your CEUs and get those turned in, but you can do tax write-offs for your membership and you can get reimbursement for your memberships through your employer too once you get hired. My recommendation is to not stop with just a CPC. Please get your risk adjustment certification too, or an auditor's certification that will put you above all the regular coders in the system trying to get jobs. Please get your coders ones. The questions that were on her exam that were, I know somebody's asking me about the questions that were on her exam. I don't know if I can bring those up real quick. Hold on. See how many tabs I got open. Lord, Always got tons of questions open. Let me see if I can find those questions. Okay, the one we did tonight about the records. This question right here was on her exam with those codes. And it was exactly written just like this. She picked slides instead of picking the records. She saw that the slides one had the words comprehensive consultation on it. And she picked that answer, and she knows she got it wrong because when we did it in our tutoring session, the answer is tied to the records response. So the answer to that question is A. It is the 25. She picked 23. I know that one was on Monday's exam. It was an online exam. What was the other one, guys? It was the office visit one. The one with the consultation versus the new patient question. I'm a-looking. This one was on her exam on Monday. It was the online CPC exam. Come on, you can focus. I promise you can. I promise. Camera, it's getting low on juice. No, there we go. Okay. This question, word for word, was on her exam Monday. The old man wants a second opinion. So all my mentees, anybody who's been watching me, y'all know the answer is new patient right here. You never, ever, ever give anybody an office consultation code if it's not a doctor-to-doctor referral, and you have to make sure that the doctor isn't being coerced into doing the second opinion. Because I had a question where the sentence said Dr. Jones was referring patient to Dr. Smith for his cardiovascular issues. You'd think right away that means consultation, but the last 3 words said due to his insurance company's requirements. So he was required to give that patient a second opinion. It wasn't his need, the physician's need or her need to make sure that patient saw another patient, a doctor, but it was the insurance company's demand. So that only gives them a new patient code. So verify, please, when you're in this question. And then there was one more. I just don't remember what it was off the top of my head, but I'll have it gathered for Saturday's live for that. I'm just tired right now. It has been one crazy day between poor Travis and everything else. I still need to pack for Phoenix and everything tonight, and it's already been 2 hours. So I hope this has been so helpful and y'all enjoyed it. And we'll do another one, and I will be back on Saturday for another 2-hour live like this. We'll do more practice exam questions. Hopefully I'll have more information for you about what's been on the exam. And if anybody is taking the exam at all, and you can save one definition or one CPT code or one HitPix that was on your exam, and share that information with me. I'll share it with other people that will make a big difference in their lives. It could be the one question that gets them from 68 to 70. Please share if you got a chance to save something. I know it's not the most important thing in your life. It is to pass this exam, but you could help me make a difference in somebody's life if you do record or highlight something in a book. That would be helpful I'll pass along that information too. So anyway, guys, I know, thank you so much about Travis and the safe travels. HIPICs are pretty tricky. They are. You got to stay organized, stay focused. Absolutely. Optum is a cheaper version. Just they're real picky about the CPT book, so be careful where you get that from. Super careful. Other than that, you can absolutely use your 2021 books for the entire year of 2022 tries. I have a document on the Etsy site that shows you what codes to add to both those books so that you can make them into 2022 books, because you can get the 2021s really cheap right now. So that may be helpful. Save you like $400 there. Other than that, I will see y'all on Saturday. Message me either on TikTok or on Messenger and let me know what kind of material you'd like to see on Saturday, and I will do my best to incorporate it. So let me show you. Let's see. Let's see. Where have I? Do I have one of those? Where am I at? I'm on screenshots. I should have screenshots somewhere. Right here. So Etsy, I have under Medical Coding by Jen, I have those documents available on Etsy that you can just instantly download, that will tell you what codes to add to your 2021 CPT or your 2022 ICD10 book, to make them a 2022 book. On the CPT book itself, I tell you what page to go write in the new codes in so that you know where to go in your 2021 CPT book and where to add the new codes to. The ICD10 one is pretty self-explanatory. You know what new code it is and where it would be based on the alphabet and index. You just go write it in. It didn't need a page number. The CPT code one does, so it was something that I added in there for that one for sure. But they're both super easy. You can delete the correct things and then by drawing one line through it and then add in the new codes. Super easy documents to watch and go through and add what you need to add or delete what you need to delete. It's a great year to do this because there wasn't that many changes compared to last year. Oh, I wouldn't even recommend it last year. 20 to 21, there was too many changes. But this year was great. I don't have the HIPICS one done yet. It is on my list of things to do. I will get it out as soon as I can. Absolutely. All right, let's pray that this recording records, and I will repost this up on YouTube for everybody to watch afterwards too. You're very welcome. I'll see y'all on Saturday.